Work, the elders, the former co-chairs and members of the independent panel. We collectively called this meeting to sound the alarm and lay out an agenda for pandemic prevention, preparedness and response, what we call pandemic PPR. World leaders are not yet acting on the lessons of COVID. They risk being distracted by other admittedly important global crises, but rather than recognizing the linkages between them. Tomorrow, a UN high-level meeting is being held on pandemic PPR. This meeting is a key opportunity to demonstrate political leadership at the highest levels, but it's been pretty politically fraught so far. We're here because the next pandemic threat is looming. We're here because political leadership matters. And we're here to say we will not give up the fight. Let's turn now to our panel. It's an honor and a privilege to welcome 4 of the elders here today. Chair President Mary Robinson, President Juan Manuel Santos, Zaid Rad Al Hussein, and the elders' newest addition, the Right Honourable Helen Clark. A warm welcome, please, for our distinguished panel of excellencies. Turning to the Right Honourable Helen Clark, former Prime Minister of New Zealand, former co-chair of the independent panel and new member of the elders. Congrats on your appointment. So turning to the issues, one of the main recommendations from the independent panel for pandemic preparedness and response, which you co-chaired with Ellen Johnson-Sirleaf, was to elevate and sustain political leadership on pandemic threats at the highest levels. Can you tell us why the engagement of heads of government and state on the pandemic prevention, preparedness and response agenda is so critical?
The 2-line answer is because nothing will happen otherwise. The other line is we have to break the cycle of panic and neglect. And as we've seen with the COVID pandemic, which really isn't over, we've been through the panic phase and we're well into the neglect phase. And to break that, you need sustained political attention on the importance of preparedness and response, because otherwise we will be doomed to repeat the painful lessons of history of this pandemic, with a death toll associated with it, now excess mortality of 24 million people, which is very many people, the cost to the global economy of about 25 trillion, social cohesion ripped apart in a range of societies, and then all the huge issues exposed about inequality in our world. Now, our panel felt that if you had drawn from the regions of the UN member states and General Assembly a high-level Global Health Threats Council, which would be a standing council, doesn't have to have a large bureaucracy around it, needs to have a secretariat, and it should be there to keep the mobilization of awareness and to comment and to really keep everyone on their toes about the need for preparedness. Also support the mobilization of finance, which, as we know, has been pretty dismal for getting support for the capacity of low and low middle income countries to continue to be prepared. The idea we put up is not a new one. It was recommended by the high-level panel led by President Kikwete of Tanzania, which Ban Ki-moon established in the wake of the Ebola pandemic. What could we learn? And exactly such a high-level, leader-level council was recommended. But then the system fought back. When the report was received, it was sent to UN heads of agencies, and guess what? You never got a council at leader level. GPMB was the result, and of course it makes no noble efforts, but it's not at that most senior level of current heads of state and government, which means that it will get less attention. Just final comment would be that the panel identified at least 16 previous reviews and reports into what should be done to be better prepared for these kinds of events. All of them are gathering dust on shelves. And as a panel, while our mandate ended with the recommendations that went to the General Assembly in May 2023, we said we will continue as individuals to get out and fight for it and keep the cause alive. And thank you to the elders for being so supportive, Pandemic Action Network and Oxfam, Winnie, so many people have really pitched in to keep this alive and try to make something of the rather grinding reform processes which are underway. Thank you.
Thank you so much. So we've just heard about the collected reports on the shelf and the many recommendations. Zaid, I wonder if you could talk about what the barriers are to implementing those kind of findings and recommendations and getting that crucial political action.
Well, first of all, I'd also like to thank the Pandemic Action Network for hosting us. The question begs a response in two directions. One is just a comparative analysis of the UN system. When you look at all parts of the UN system, the immediate sort of observation that comes to mind is, why is it that there are certain parts of the UN system that are highly developed and mature, where the mechanisms are layered and there's a measure of surrender of sovereignty which is acceptable. And then in other parts of the UN system, it's highly underdeveloped, almost primitive, and it's sort of staggeringly slow at getting anything done. And health is one such sector. The other is climate. When you look at the pillar that Mary and I were in charge of for many years, human rights, I mean, you have in human rights an interesting array of different incentives and disincentive structures to get governments to do things. Right? That doesn't exist where you have voluntary systems and only voluntary systems. And that is where we are with health. Now, there is a fundamental problem we have in Geneva at the INB. The very tool for negotiating a treaty alongside revisions to the international health regulation is the wrong tool. The Bureau has decided upon a method of negotiation which cannot work. It's a technical issue. It's not a political issue. If we were to basically convince the Bureau to change the way it's operating between INB 6 and INB 7, and we have a situation now where there's mass confusion, no one knows what happens in terms of the actual negotiating. The Bureau seems to take decisions on behalf of the membership, and it shouldn't be. The membership should itself decide what goes into the sort of early phases of the treaty that's being negotiated. And I think if we make adjustments there, it becomes easier then to push upward and to sort of insist from political leadership, okay, we've got now an agreement on access and benefit sharing, on IP, on finance. We've got all of that. Now we need supervision from the top, and we need verification. And if we build it like this, we can get somewhere, I think.
Thank you so much. Moving to President Robinson. President Robinson, you've been a real leading voice for climate action. What do you think it will take to get leaders to start focusing on pandemic PPR and respond as seriously as they do on climate, with increased investment and that kind of accountability that we see at the COP?
Well, first of all, I too would like to thank the Pandemic Action Network for hosting us and for allowing me to be together with 3 of my fellow elders, and the first time on a panel with Helen as an elder. So great stuff. Climate is different, as I think Zaid has been illustrated, in 3 different ways. First of all, the science is very strong on climate and getting stronger. Yesterday, I took part in a meeting where we launched the Guardians of Planetary Boundaries, which is a more holistic framing. And of those 9 planetary boundaries, we're already in danger zone on 6. So it's worrying. And that can guide and also the facts on the ground. We're aware that climate is happening, so we're aware we have to do something about it. Secondly, at least that's the second point, that we see it with our own eyes, whereas what we have, as Helen put it so well, we have the kind of cycle of panic and neglect with pandemics. We've just been through a terrible pandemic. We should have learned all the lessons and implement that preparedness report that Helen and another elder, Ellen Johnson-Sirleaf, co-chaired. And thirdly, We're aware of the financial cost of climate increasingly. You know, in this country, the billions from hurricanes, the billions from flooding in places like Florida, the billions, you know, it's all billions now. And it's very, very substantial. Same thing is happening in other countries like Pakistan. You know, a third of the country flooded last year. Look what happened in Libya very recently. So we're very, very aware. And yet, I co-hosted and chaired yesterday morning at 7:30, a little bit earlier than today, a meeting of women leaders. And we had Amina Mohammed, Kristalina Georgieva, and Ngozi at the opening. And all three of them lamented that health is not getting a proper priority. Very much the points that that Helen was making. You know, it was really interesting, and how serious that is. And so I think we do need the work of civil society, of other voices of business, of young activists, and that's why the Pandemic Action Network is so important, and the elders are so supportive of it. And I think we also need to link climate and health much more. Actually, one of the things we did at that meeting yesterday morning was launch what's called Accelerating Climate Adaptation for Health Equity. And it shows the kind of points that, if I may, I'd just like to literally give the 4 key messages, because I think they'll resonate. I'm sorry, find the page. Okay, a second. There are sort of sorry about this.
Just while you're finding, oh, you found them.
The 4 key points: putting local communities at the center of decision making and solutions, building on and applying evidence of effective local solutions, channeling flexible finance directly to local communities. That's the wrong page, actually. Don't worry about it. But it talks about health workers. It talks about, but it actually talks about the cost of health, and that is something we haven't factored in. The enormous cost of fossil fuel on health, 7 million dying a year. The enormous costs of heat on health caused by global warming. The incredible costs. And I think we need to factor that in as well, as it has helped the climate space.
Very well said, thank you so much. And that's that kind of overlay of health, climate and pandemics is something that Pandemic Action Network is very seized of. So we'd love to keep working with you on that nexus. President Santos, as a former head of state, what is your call to world leaders for the high-level meeting on pandemic PPR this week and beyond?
Well, again, thank you very much for having us here today on this very important subject. The first thing I would say is we need to promote the truth. When we saw what happened in the pandemic, so many governments minimizing the problem, exaggerating what they were doing, and in between, what happened in terms of corruption and inequity. And I think that we need to evaluate much better what happened in order to be able to take the correct actions. On the other hand, leaders need to take bold decisions, unpopular decisions. This is an issue that has become a non-issue for the people in general. You go to any country, your list of concerns and pandemics don't appear. So you must raise the issue for people to understand. And how do you do that in today's world? Well, in today's polarized world, where emotions are taking over arguments, we need to make an effort to get to the people's hearts and make them aware that it's not if a pandemic comes, but when, and the consequences of that pandemic. Remind people of what happened during the pandemic. Remind them again and again. Remember that in political communication, if you say something one time, it's not enough. 10 times is not enough, 100 times is not enough. It's about 3,000 times, and then people start to hear. We need something of that sort to address the issue of the pandemics. And I would say also, leaders should take much stronger and unpopular actions. I remember when we were negotiating the creation of the World Trade Organization. That was 30 years ago in Geneva. I was a young trade minister, and an African delegation said, when we were discussing intellectual property, please don't put money over life. I remember that phrase. And this is what happened right in the pandemic, when we started discussing about giving in licenses to countries to produce the vaccine. So these are the type of actions. And last but not least, very important, in politics also, how do you show love? Through the budget. And we need much more commitment from all the countries that we really are interested in addressing this issue, and that translate those words in the budgets. Otherwise, look at what happened with a fund that was launched last year. Where's the money? So I think you need much more determined action.
That's absolutely fantastic. I think the love budget is going to be drafted and endorsed by everyone in this room, and let's see what we can do with that. So you've actually preempted a little final call that I wanted to ask our distinguished panelists. Just in a line, I was going to ask, for all the campaigners and advocates in the room that really want to push this issue, might be a bit disheartened about the fact that it's slow, quick, sometimes 3 steps back, a few steps forward. And we heard from you, President Santos, love budget, and also constant communications, consistent communications. I wondered if our other panelists had some advice on how to keep going, just in a line before we close the panel. Helen?
Old saying, Rome wasn't built in a day, was it? So you just have to keep going. This is going to be a long-term struggle. I should also give a shout out to the People's Vaccine. I see Winnie B. and Yuma here. What an amazing job just standing up at an early stage and advocating for equity. There's a lot of big issues at stake here. We just have to keep at it.
Thank you. Zaid?
Well, Well, obviously, the advocacy must continue. It's not courageous to speak when everyone is speaking. It's courageous to speak when no one dares speak. And in that moment, when everyone is terrified of the consequences of saying something, that's when you have to say it. At the moment, we need the negotiations to succeed in Geneva. If they don't, we need a backup plan. You can advocate for that. It needs to come to New York, in my opinion. Years ago, there was a treaty being negotiated on, it was nuclear terrorism, if I remember correctly. The IAEA insisted that it be held in Vienna. That's where the headquarters of the IAEA is. The member states decided it was too big an issue to be negotiated in Vienna by the experts, and it needed to be negotiated in New York. The IAEA protested. The UN prevailed, and it was negotiated in New York. Why then is this being negotiated in Geneva, right? Okay, now 2 years in, let's see what happens. But if by INB 7, by the end of the year, there is still mired in confusion, no clear way forward, no one knows what's happening to proposals, no actual negotiation, right? 2 years in, someone has to say enough, right? Enough of this. We need to shift it back to New York, and then you need to have double down on all the points that Helen was saying. And so there has to be a strategy here. When I witness many of the organizations, some represented here, take part in the INB, the comments are really good, but no one is really pulling the trigger or squeezing them, right? And now I think we need to start to squeeze.
Thank you so much. President Robinson, advice to campaigners.
Yeah, and I think obviously the reason to get to New York is because it's so much more than health. We do need to strengthen the WHO, but we need to realize pandemics affect the whole economy. It's an incredible devastating impact, drives countries into debt, etc., etc. If I can just maybe draw on the climate experience, we are trying to have the broadest, frankly, climate justice movement possible from a climate perspective, because although we're on the cusp of a clean energy world, we're still moving too slowly, and we're actually heading for catastrophe. And we're slowed up by this 4 billion budget of the fossil fuel lobby, messing the science and prolonging fossil fuel where it shouldn't be. So we're trying to gather all the forces. So I would say in the health space, we need to do that too. Widen to as wide as possible a circle. Health is everybody's business. It's every family's business. So, you know, kind of get the same kind of connected movement. It's business's business. It's workers' business. It's, you know, that's why I think the Pandemic Action Network has been doing a very good job, but needs to really feel this has to be much more of a real issue where we take it out of just health into the broader impact and devastating suffering that is caused by a pandemic. And as Juan Manuel so rightly said, it's not a case of if we have another one, it's a case of when. So we have to move.
Thank you so much. I don't know if you have more suggestions, President Santos, because you already, as quickly.
Well, also in politics, it's good to have good allies. And what Mary just mentioned, if the pandemic could be presented with climate change, with deforestation, with the survival of biodiversity as an essential part, that would enhance the visibility of the pandemic. And leadership is also the art of teaching. And when you explain, for example, to a community or to a country that deforestation creates the migration of animals that get in contact with human, and that is the source of pandemic, people start realizing and understanding and then reacting. So I think get allies and teach.
Thank you so much. So can I please hear your warm appreciation for President Robinson, President Santos, Zaid Al-Hussein, and Right Honourable Helen Clark. If I can invite Helen Clark and Zaid to stay on stage, and please follow me. Thank you for all the work you do. It's incredible to have your leadership, and we're so grateful. And we are going to transition to the next panel. There will be a Q&A session after the next panel, so you will get to have a say. And we're having a dance too.
Loath to interrupt. Hello.
Well, thank you all. What a terrific panel and wise words to get us started for this morning and for this week at the UN General Assembly. I'm Carolyn Reynolds. I'm one of the co-founders of the Pandemic Action Network. So many points struck with me from that conversation, but one I will reiterate here because I think it makes a great segue to our next conversation, which was President Santos, who said, if I paraphrase, but leaders need to be prepared sometimes to take unpopular actions. And I think that is a really critical message because we've seen especially with the ending of the COVID emergency, the transition to pandemics being off the radar, pandemic amnesia, if you will, forgetting all of the things that the world went through the last few years. And sometimes we need our leaders to step up and do what's right. So we're going to dig in deeper on some of the issues that were just raised with on what leaders need to do and what priority actions need to happen in the coming year, really in those areas that we started talking about this morning: governance, accountability, financing, and equity, to drive more effective pandemic preparedness, prevention, and response. And we have a terrific panel here of leaders and experts to to take that conversation forward. I'm delighted that Helen and Zaid will be from the elders are going to stay here with us to continue the conversation. But let me briefly introduce our other speakers. We have to my right, we have Vice Minister Alejandro Solano from Costa Rica. He's the Vice Minister for Multilateral Affairs. To my left, we have Joy Pumathi, co-chair of the Global Preparedness Monitoring Board and former Minister of Health from Botswana. We have Magda Robalo, who's the president of the Institute for Global Health and Development in Guinea-Bissau and also a former Minister of Health. We have Paul Friedrichs, who's the inaugural director of the new White House Office of Pandemic Preparedness and Response Policy at the White House. Welcome, Paul. And Juan Pablo Arube, who's the global director for health, nutrition, and population at the World Bank, and also the director of the Global Financing Facility, and a former Minister of Health in Colombia. So we have many formers. And then finally, last but not least, Winnie Byanyima, who's the executive director of UNAIDS and an undersecretary general of the United Nations. So a terrific, rich panel. I'm going to start with the Vice Minister. This is a very busy week for you at the UN General Assembly, and I know you need to leave to attend to your duties over at the UN headquarters. So Vice Minister, Costa Rica was really one of the champions for calling for what will happen tomorrow, the first high-level meeting on pandemic prevention, preparedness, and response. So you were a champion of that resolution. And I want to ask you, well, first of all, there's some buzz. Maybe you can tell us, are we going to reach consensus on a political declaration? Because some people are wondering if that's going to happen. So maybe you can make some news here. But more importantly also, is this meeting going to meet your expectations? You called for it. And if so, why or why not? What should we expect tomorrow?
Well, thank you very much and good morning, everyone. And it's really a pleasure to see this room full. Well, I think we are all optimistic for tomorrow. Otherwise, we are not part of this process because we believe in this process. And that's why we are confident that tomorrow we should adopt this declaration. But more than to approve this declaration tomorrow is what are the next steps? Because we think that, well, we need to have in mind that this is a non-binding declaration. It's just a political declaration. We need concrete steps in this process. And this is probably the most important one because this process complements the Geneva process. But we need to be confident that the process we strengthen after this political declaration because reflect the political will of the head of states and all the states in this process. We need to learn about the past. And probably this is one of the challenges because it seems probably I would like to ask all of you how many health sanitary measures all of you have taken before to enter to this room. Probably none, because everybody forgot that just 2 years ago we were in the pandemic time. So just two with masks. So let me say that this is very important one because we need to be to promote consensusness and awareness about what hard time we live in that time. And this political will that we will see transformed tomorrow in this political declaration will be very important. But we are confident that the next step will be the most important one in this process.
Well, let me quickly follow on that, especially since I know your time is short. So on those steps, I mean, what concretely do you think is most important to have happen, and how do we actually keep this? The elders talked about that commitment to political leadership and the need for action, but how do we keep this on the top of the political radar and stop this cycle of panic and neglect? I know you served in Austria and been very involved in. They talked about the International Atomic Energy Agency, but how do we keep this at that same level of political priority as other issues of collective security?
Well, I think that's a very important one is to try to proper coordination of all UN systems in this process. You said, well, I had just served as an ambassador in Austria 2 weeks ago. So this is probably one or two of my first meeting as once again as a deputy minister of foreign affairs of my country. But I have been aware of the process in Geneva because also I served in Geneva during the time of Mrs. Robinson being the High Commissioner. So in that time in Geneva, I was part of the national team in the process of the international health regulation that in that time respond to that another threat. But I think that probably one of the things that I have seen after 3 decades serving as a foreign service in my country is that there are still a lot of gaps between different international agencies of the UN system. So more recently in Vienna, I saw the great job developed by the Atomic Agency in terms of develop capacity in the states. Probably the response of the IAA was very important one in terms of providing some equipment, devices to the states, and the software, for instance, to identify the disease. But I think that the most important one is concrete steps, and that's why the states request from the UN is to try to coordinate the efforts that have been developed, isolated for different organizations. The International Animal Organization is a very important one in this process also. So these different actions developed by different agencies need to be appropriate and in a better way coordinated to respond in the way that the states request from the UN system. But also from the states, we need more political will. But it's clear that this political will be reflected in the negotiation process and what kind of political commitment that the states can adopt in this process. So I think it's a complement of the action of the UN system and the action by the state through the political will.
Well, and if I may add, I mean, the other parallel, though, with something like nuclear issues is enforcement, right? It's monitoring and it's enforcement and it's continually keeping it on the agenda. So thank you so much. Vice Minister, I know that your time is short, that you have duties to attend to, so please join me in thanking the Vice Minister for his leadership. Winnie, let me turn to you next. Winnie, you've been a lifelong warrior for equality. And in fact, you also, in addition, as part of your job, you just established the new Council on Equality, AIDS, and Pandemics. I want to ask you, we started talking a little bit about the pandemic accord. I wanted to ask you a little bit on your take on those negotiations, which are really in that messy middle right now, right, of negotiations. So what do you think is needed to break through so that we can actually reach an accord by next May? And what can we learn from the experience with HIV and AIDS in terms of how we really push progress on pandemic PPR?
Thank you, Caroline, and the Pandemic Action Network for organizing this very important meeting. And congratulations on the call to action. I'm glad you've raised the question of equity, inequality. The Global Council on Inequality, AIDS, and Pandemics, which Helen Clark is a member of, has come out with a paper recently where they show that inequality, that countries with higher inequality also have higher rates of HIV infection, higher rates of deaths from HIV infection, and also had higher rates of COVID mortality. There's a strong association. Inequality is driving pandemics within countries and between countries. The pandemic, you ask about the pandemics treaty. We see it in a kind of a stalemate, and it worries us because we cannot let this political opportunity to make the world less vulnerable to pandemics just pass like that. We must make the most of it. And our experience, 25 years of experience in the global response on HIV, teaches us many things that we can get into this pandemics treaty. First, a plan, a global plan. You have a global pandemic, you need a global plan. And 25 years ago, we could do that. The world came together. made a plan that is renewed every 5 years with a political declaration. It's political. Every 5 years, the world meets here in New York, sets new targets, and the rest of us work hard to achieve those targets in every country. That should happen and should be there in that treaty, that you need a global response to a global challenge. The second you've talked about, sharing technology. That's the elephant in the room. And talking around it, finding little ways around it, won't solve it. We need to have a model where new technologies are shared immediately. We need technology transfer well integrated in that pandemic treaty. Otherwise, we are back to where we were. How did this happen? Well, people rose, people living with HIV rose. And at the height of the pandemic, the AIDS pandemic, people were dying when ARVs were there and were being monopolized. What do we have now? In many countries, flexible pricing. We have many countries, 30 million people are on treatment in the world today. Only 9 million. We are trying to get on treatment, but 30 million are on treatment because prices came down. And how? By sharing the technology, sharing patents, governments using their legal power to compel companies to share the technology where necessary. Factories built in the South, so now we have production in the South. We need to get that model there. There are many ways to incentivize innovation. Monopolistic control of technology can't be the way we will stay. We have to change that. 1.3 million people died unnecessarily of COVID because of inequitable distribution of drugs, of the vaccine. So we need to have the accord supporting tech transfer, local production, and flexible licensing. Third, financing. You've talked about it too. At the height of the AIDS crisis, countries in the South had a debt crisis, just like now with COVID. Countries in the South were so highly indebted, they were not putting money into their health systems. That's what we had before COVID. We had most of the low-income countries having to pay debt servicing 9 times more to debt servicing than to health. 9, 10 times more. That's where we were at COVID. That's where we were with HIV. But what happened? New ways of financing came up. The Global Fund was created with its innovative way of financing. And then there was major cancellation of debt. The HIPIC, Highly Indebted Poor Country Initiative, happened, and there was cancellation of debt, and countries could now begin to strengthen their health systems. What happened with COVID? Wow. You had something called the Common Framework created. 2 years after the Common Framework, only 4 countries had applied and only 1 had succeeded, and it is still working out modalities. This is what happened with G20. So you have to find a way to access finance, and that too should be part of this treaty. How do you get every country to have the money to pay for lives to be saved? Lastly, communities at the center. One of the elders raised this. It was so critical. But what do we have now? We talk about community outreach, community engagement. That's not partnership. That's targeting communities. That's not partnering. We must have communities reaching those people whom governments can never reach. So communities at the center isn't an extra thing, it's a must to be able to succeed. Those are 4 things I've mentioned that I would like to see, we want to see in the pandemics treaty. And I think my last point is the elder who said that it's leadership. It's doing those things that are not popular. It is looking at the whole world and not looking at your own country and your own economy. And this will take, leaders to rise. And that's why it's so good the elders are making this call to action.
Thank you so much, Winnie, and thank you for being so concrete, but also to the point. We need a global plan, we need technology sharing, we need money, we need communities at the center. Let me dig in on the financing part. And President Santos talked about that's how we show love. We show it through the budget. So Paul, let me turn to you. There is one thing that, and it was mentioned, that concretely did happen in the last year, which is that the world did come together and decide to create a pandemic fund. We're not anywhere near where we need to be, but it is a start. But that was championed by the US and particularly also by Indonesia and their leadership of the G20. It's now a year old. It needs a lot more money. The US is the largest investor to date, 700 million out of about the 2 billion that's been pledged so far. We need to get to 10 billion a year. That's the estimate in terms of what it will take. That's a lot of money, but it's also not a lot of money compared to the other global challenges that are out there. So Paul, how do you see this from your vantage point, sitting now at the White House, and how are you going to work with other governments to increase the resources to get to that goal?
Carolyn, thanks. And let me start also by echoing the thanks to you and Pan and to the elders for putting this together. It's remarkable to see so many faces who have been fighting this issue and fighting with us on this issue. To your comment about financing, I think you got it exactly right. This was a day one priority for President Biden when he came into office. Some of you may recall that literally on his first day in office, he highlighted the importance of this issue and his commitment to pandemic preparedness and response. And as we stand up the office that I'm now privileged to be the inaugural leader of, going back and looking at that, we have consistently highlighted this as one of this administration's priorities because we see the risk, as was so nicely outlined by the elders in the first panel there. The pandemic fund is part of that solution. And Winnie, I would go back to your kind and very pointed comments there. You know, the partnership on PEPFAR was, again, part of that partnership in which the United States joined with others to move forward. And that is what it's going to take again here. As you said, we've committed $700 million in Hiroshima. President Biden committed another $200 million or $250 million. And we are eager to see others stepping up to the commitments that they've already made or adding additional commitments so that we can help with the work that's been laid out by so many going forward. And how do we do that? Part of it's discussions like this, highlighting that there are some countries that are stepping forward. You mentioned Indonesia. We've been grateful for the partnership there, and highlighting the opportunities for others to be part of that commitment, both in words and in deeds as we go forward. And I think as the elders laid out earlier, also highlighting the benefit of these commitments. You know, the study that was done by the G20 last year highlighted, and I just want to make sure I get the numbers right here, a health gain value of $1,700 for every dollar committed towards pandemic preparedness, and an economic gain of $1,100. That's a tangible benefit that hopefully will resonate with political leaders as they look for those difficult choices that have to be made. And we think that we're seeing the benefit of the pandemic fund when we look at the number of applications that are received. Clearly, there's tremendous demand. That's why we're having this discussion. That's why so many people are here. But we received 179, not we, the United States, the pandemic fund received 179 requests in the initial tranche of proposals, of which the vast majority focused on workforce, interestingly. And it gets back to that community level point, Winnie, that you made so eloquently there. We are eager to see partners step up and join with us so that we can address those requests as they come forward, and we can help address those workforce challenges, because without those frontline workers, the rest of it becomes very difficult, if not impossible, to execute.
Thank you, Paul. We're going to come back on that issue of financing in just a little bit, and Juan Pablo be on notice. But first, let me turn to and pick up on the point you just raised on health workforce and turn to Magda Raballo. Magda, you have seen this challenge from so many perspectives, and you've been a real champion on health workforce and health systems. And we're, as we talked about a little bit before, I mean, we are also increasingly need to connect these issues of how we build not just pandemic resilient, but also climate resilient health systems. So what is that most urgent thing that we need to do from the perspective of a health worker, from the health workforce, that leaders have to do over the coming year to get ready for the next crisis and hopefully prevent the next pandemic?
Thank you so much, Caroline. Good morning, everyone. And really, it's a great pleasure to be here discussing this very important issue. I think, let me put some 3 points up front to just frame the context. It is clear that the political leadership of the world has moved on. They moved on, and the pandemic prevention and control has become just a managerial issue. We need to bring them back. Not with the, this is the thing to focus on. It's not an either or issue. It has to be combined with other top priorities. So we really need to find negotiating points to bring back pandemic prevention, preparedness, and response to the leadership list. And then the third point is about the centrality of the healthcare workforce. Just like you said, there is no way we are going to prevent, prepare, respond to if we don't address the critical issue of the workforce. So the healthcare workforce, it's a crisis within a crisis. Before the pandemic already, we had alarm bells being ringing, telling us that the shortfall in terms of people that was needed to address the health challenges was huge. It became massive after the pandemic because many died, burnout settled in. We have seen great resignation. We are seeing an accelerated migration from health workers from the global south to the global north, and we are not seeing adequate investments to recruit, retain, motivate, and expand the healthcare workforce. So that brings us back to the issue of financing, which we cannot escape from. We really need to see, for a country like Guinea-Bissau, where 90% of our GDP is actually compromised with debt, how do you ask governments to invest in the health systems and in the health workforce? We are seeing strikes all over the place, global south, global north, in France, in Portugal, all over the place. So we really need to bring this issue back to the table. And as countries negotiate their debt servicing, we need to put social sectors, health and education on the table. It is important to also invest in improving the infrastructure for service provision. Healthcare workers were badly responding to the pandemic because of the outdated technology and equipment they had to adjust to the challenge of the pandemic. So innovation, technology, investments to improve the health infrastructure and protect health workers need to be financed. And then maybe I will just end up by saying that we need to correct the misalignment between leadership and governance mechanisms. We have governance mechanisms which are outdated and not responding to the ambition that is required on these times of crisis. Thank you.
Thanks, Magda. As you're speaking, it reminds me of something I find myself saying, unfortunately, all too often, which is there seems to be this, acceptance that, oh, well, we went through this, so of course we're not going to let it happen again, and we'll be fine. We learned those lessons. But if you just take the health workforce and the stresses and all the statistics you outlined, and we know how our health workforce is more strained than ever, that actually we're less prepared. And that is something that leaders have to understand. They're making this political calculation that they won't be around when the next thing happens. It'll be somebody else's problem. But in fact, it could be their problem. And it's more likely to be their problem because of how decimated the health workforce and the health systems are as a result of this crisis. So very important points. Joy Pumafi. Joy, you've seen this challenge also on pandemic preparedness response from so many vantage points as well. But now you're co-chair of the GPMB, which was set up by the World Bank and WHO after Ebola in 2018, recommendation of the Secretary General's high-level task force on the global response to health crises. The GPMB put forward a position paper going into this high-level meeting tomorrow, You had strong recommendations in that about what needs to happen. Where do we need to make the most progress in the coming year? And how does the GPMB see its role in holding, and how will you help hold governments and institutions accountable for progress?
Thank you so much. And can you hear me? Oh, excellent. I also want to thank the network for hosting this, and of course the elders for continuing to lead the way for the global community. What worries us within the GPNB is that yes, we have a responsibility. We've been given a mandate. We are set up as an independent body of experts, global experts. But apart from shining a light on what needs to be done and what is not being done, and maybe giving a voice to the inequities that the elders talked about earlier on, that members of the panel are talking about, shining a light on the lack of leadership, the poor leadership, and our failure to learn from the lessons of both Ebola and COVID, and also the lack of effective monitoring that will enable us to take remedial action where it is required. So apart from shining a light on that and proclaiming loudly, beating the drum, we don't really have any other teeth. And that is why we were counting, first of all, on the high level meeting declaration, that the declaration will have some strong language that will address the gaps in equity, in cohesion. You know, we spoke, the elders spoke a bit about the need to link pandemic preparedness and response to climate change, to the great challenges that are facing us around as a global community now. Pull them all together. There's a need for cohesion so that we don't continue to fight battles separately. But the cohesion also talks about us working together. So what we called for is that this high-level meeting declaration needs to have strong language. But unfortunately, we have, as you are all aware, the language in the declaration is not as strong, and it is not actually committing to take the assertive action that is required. So what we are now relying on is the INB that is negotiating on the treaty and on the international health regulations negotiations. But we really do need to have strong language, and we need to have mechanisms within the treaty that will hold partners and countries accountable. In 6 weeks' time, we are going to release our report on the state of the world's preparedness. We have developed a monitoring framework which focuses on all these gaps that partners have been talking about, the issue of financing, lack of access to technology, lack of sharing of intellectual property, the human resource challenge. But what we are finding, having used started to apply our monitoring framework, is that the world is dismally unprepared for the next pandemic, which is definitely coming. So you will see this in our report in 6 weeks' time.
Is that a headline, dismal? Pardon? Is that the headline, dismally unprepared?
We are dismally unprepared, and that is the sad aspect of the dilemma that we're in. But we also have a huge opportunity with the treaty, convention, whatever you choose to call it, that is currently being negotiated, to actually finally make a difference. So I would like to end with a note of hope, that humanity must learn from its lessons. But we all have a responsibility here, a combined responsibility, to make sure that this message is very, very clear to our leaders and to those who are going to make the decisions and to the negotiators who are currently negotiating the INB. We know that there is lack of trust, and that COVID and the current geopolitical environment globally has diminished level of trust, particularly between the North and the South. But we must set these differences aside for the survival of humanity. And I really want to thank the network for giving us this opportunity to express our views, and urge you all to read the report when it comes out and to use it as leverage to take action. Thank you.
Thank you, Joy. That's the kind of passionate advocacy that we need, and also optimism. And the Vice Minister also said that, right? Like we have to continue to fight, and we can't just think that this is hopeless. And there is movement, and so we have to see these things that leaders have started. We have to see them through. Juan Pablo, one of those institutions that can do something about all of this, right? To strengthen pandemic preparedness and response is the World Bank. It has a really key role to play. You have a new boss. He's I think, speaking across the way. And as you know very well, pandemic preparedness is really that whole of government issue. The World Bank is in a major discussion with its shareholders right now about how it's evolving to meet global challenges. And pandemics, which is good, is stated as one of the priority issues for that evolution. But what's going to change? What's going to change as a result of this? And how will the bank, but also the rest of the international financial institutions, really work with countries to increase the focus and attention, prioritization, and importantly, funding for this agenda?
Caroline, thanks so much. And thanks for everybody for being here. I think this is the right discussion at the right moment, and congratulations again to Pan. Look, let me start with two parentheses. One, we've been doing a lot of work about health spending in the different countries. By the way, I talk about countries because we can discuss in New York, and we need to do global and regional advocacy, but the reality will change on the ground in our countries. And what we have found, and you know very well, is that the fiscal space and the spending capacity in health systems is going down. So for me, that's a big parenthesis. Yesterday, second parenthesis, Caroline, with WHO, we were presenting the global monitoring report that we do every other year, and what's happening, again, at the country level, in our countries, in access to essential health services and on financial protection for households and individuals who are accessing health services. These are the two elements of universal health coverage. And what we saw with incomplete data before the COVID pandemic, Caroline, is that access to essential health services had stagnated. And that the financial protection that our systems were providing to our most vulnerable people, those near poverty or in poverty, even those in extreme poverty, was going down. For me, these two parentheses are fundamental in this discussion. And let me say why. Because we're here, I would say, with the right impatience, but we should also be here knowing that we're here for the long term. We're talking in PPR about building institutional capacity on the ground, in a community, in a village, in a district. We're building institutional capacity from the national level, think about the National Institutes of Health, all the way down to the poorest district in low and middle income countries. By the way, the biggest risks in the most difficult spaces are precisely those with the weakest institutional capacity. And we're trying to do it in an area like pandemic preparedness that requires, as a must, cross-sectoral collaboration. One Health, AMR, deforestation, migration, fragility, conflict, are all bound with pandemic risks. And we're also talking about in countries, and again in subnational levels, where the most basic needs are not being met on a day-to-day basis, where a woman delivering a baby is at risk. We're expecting them to have this preemptive capacity to respond to a future risk. So I want to be very realistic here. I don't want to sound negative. On the contrary, I think we need to be optimistic, we need to be impatient, but we need to be realistic that this is not a single bullet, a single instrument, a single momentum. but a long-term journey to really improve our capacity to respond. And in the center of it, it's health system strengthening. Again, if we're taking people away of financial protection, if we're taking people away of visiting a health center when they're sick, because they're gonna be thrown into poverty, we're just increasing our risk for pandemics, and we're weakening our capacity to respond. It's the same thing that we're talking, but I want to put it in that context. And by the way, I also want to make a call for the strengthening of the pandemic fund, Paul, as one real instrument that we didn't have 2 years ago, and now we have, that is working incredibly well in terms of its potential, and that if we put our heart in it and our love.
How much money is in the
Exactly. Well, by the way, Winnie, I'm gonna take President Santos' message to everywhere I go, except to my house. Imagine if my wife hears that message, no? See, the love is the budget, Juan Paulo. But the pandemic fund targeted resources for the long term in a collaborative approach, country-led, around health systems with all the right elements. I want to do those two parentheses. Now, let me quickly, and sorry for that, Caroline, let me move to the bank, if I can.
Yes.
Very quick. Okay, no, but very quickly. Look, the bank is going through a big reform, and Caroline knows it very well, and many of you here in the room, where it wants to be not only country focused, but also more engaged in public global goods, in things like pandemic risks that cut across countries. And for that, I think it's going to be very important that the bank is able, as President Banga is saying, to mobilize with a sense of urgency more resources, and in particular, Caroline, more concessional resources. In pandemics, the concessionality of the resources is extremely important. When the pandemic struck, many countries, low-income countries and middle-income countries, had money available, but they did not want to divert it from other needs into the pandemic response, and we saw that. We're also enhancing the financing instruments toolkit, and things like debt clauses are being looked into and are being brought into that. And pandemic PPR is becoming a global priority program for the World Bank. So you're going to see much more of the World Bank. Let me conclude. We are looking at the search financing with a lot of detail with WHO in the Joint Health and Financing Task Force. We're looking into how to enhance instruments. But one of the conclusions coming out of those in-detail exercises is that collaboration and coordination around the framework of response is crucial. And I would conclude by saying it's a responsibility of all of us together. It's not the World Bank or the multilaterals alone. It's not one instrument in itself. We need to increase domestic financing. We need to bring the private sector. And again, we need to show with our actions, with our budgets, with our investments, that health systems as a whole are a priority. If we're not able to do that, if health systems remain on the sidelines of government priorities, we will not be better prepared.
Thank you, Juan Pablo. A lot of richness there, but it just underscores the challenge we have ahead of us. Helen and Zaid, let me turn back to you. Picking up on what you've heard, but also specifically, Helen, you've been so articulate about the need to make sure we're going to get, how do we actually ensure that we have a system in place to not repeat the mistakes of the past, particularly on equitable access to countermeasures?
Yes, I want to come back to what Juan Manuel Santos said when he was a young trade minister, and an African minister said to him, "Don't put money over life." And what we saw in the pandemic was money over life. We saw obscene profits for pharmaceutical companies. In a pandemic, all bets should be off on IP. What is more important than giving people a chance for life during a pandemic? If we go back to the AIDS pandemic, when IP wasn't shared, people were being denied access to antiretrovirals and the chance for life. Eventually, the world was shamed into allowing TRIPS waivers for those. Why on earth was it not shamed into waiving IP for the essential vaccines and therapeutics to fight this pandemic? It is truly, truly shameful. And I don't buy for one moment the argument that if you wipe IP, you somehow, quote, stifle innovation. I've been a health minister. I know the pressure that comes on governments to supply branded drugs to populations. The reality is that far more is spent on branding and marketing than is spent by companies on research. And with the technologies that in the end provided the solutions in the vaccine and therapeutic area, there was a ton of public money across many countries that went into the development of that. But it's the old story, isn't it? You socialize your losses and capitalize your gains. So the taxpayers of certain countries paid for these things to be developed, but then paid through high prices to get the results. So this is really, a blight on the global conscience, I think. Now, what do? The panel referred to the need to create an equitable end-to-end ecosystem, which would, in the end, mean that never again would countries in the global south be dependent on the charity of the north for access to vital countermeasures during a pandemic. And some of us have been working to take those ideas further and have published in the Lancet and Nature and other places on what could be done. So we say, take the concept of the WHO mRNA hub and spoke system, the hub based in South Africa and then the spokes around, broaden the technologies that a R&D hub like this is able to develop, and invest in those R&D facilities in low and middle income countries. Now, if you have that strong investment, then the R&D can be being done simultaneously through the global south. It needs to be linked to a capacity to manufacture. And then in the event that the worst happens and you need rapid access to countermeasures, there need to be some funding mechanisms that are kicking in for surge finance to get stuff out at scale, and also to support the capacity to go from producing and shipping to actually jabs and arms and drugs are taken. And I think one of the limitations of COVAX, and there were a number of limitations as shown in the review of it, was that it didn't focus on capacity building. My country's a high-income country. We were challenged to get a jab in the arm of everyone over 5. Well, high-income countries found it challenging. Low-income countries find it extremely challenging. You need to support the capacity to do it. So the equitable ecosystem has to start with R&D, and it has to be linked to manufacturing capacity. If you take Africa, for example, it's long had a pharmaceutical manufacturing strategy, probably a bit inhibited by the fact it hasn't had common approval and regulatory processes, but that can be, and is being actively addressed. Obviously, I know Joy is very familiar with that. So we can do better. And what we have to aim at is the capacity across the world's regions to be part of the R&D story, to scale up manufacturing, to be supported at the point you really need solidarity, to get the stuff out there and to save people's lives. If we don't learn this from this catastrophic experience of northern countries hogging all the vaccines, and still today you'll find health workers in low-income countries that probably never had a jab, let alone many of the vulnerable elderly and those afflicted with NCDs, and not least with other conditions. Winnie's constituency, people living with HIV, how tough for them to be trying to fight off an infection from COVID. So many lessons to learn. The WTO, of course, has failed miserably to work on the TRIPS waiver issue. There was a kind of an agreement going back to a couple of years, but in essence, it streamlined the compulsory licensing procedures. It was not a TRIPS waiver. We still don't have a TRIPS waiver or agreement that something like a TRIPS waiver needs to kick in the event that there's an existential threat to human life. So that's my view, that there's some fundamental changes of attitude needed here. And for high-income countries to continue to protect the right of pharmaceutical companies to make vast profits by hanging on to IP, I think this is reprehensible.
Clearly, you're speaking to a supportive audience. The issue is speaking beyond this room, right? And to people who are in a position to make those changes. But Zaid, actually, you're the perfect person to maybe conclude this part of the discussion on, and I want to turn to the audience in a minute. But all of these things, we're talking about making multilateralism work differently, better in the face of a global challenge that requires all of us to act in the collective interest. So whether it's the pandemic accord, whether it's a pandemic countermeasures platform, it's more money for a pandemic fund, it's all of these things. It's how do we force, how do you get governments to act in that collective interest? So your thoughts on that?
Well, it's almost an accepted axiom that elderly people tend to be grumpy or are grumpy. And Mary always injects this sort of joyfulness into any panel, and rightfully so, but she's not on this panel now. Look, we are here because we are disappointed. We are disappointed. The political declaration, whatever form it takes tomorrow, is weak. It's a disappointment. The negotiations are a disappointment. The actions taken by the pharmaceutical companies are a disappointment. So why are we in this situation? I don't know how many students of the League of Nations are here, but those who are here can maybe tell us why the League failed. One of the principal reasons the League failed is because they adopted in the covenant this basic rule in Article 5, nothing is agreed till everything is agreed. It was the operating principle in the General Assembly and the operating principle in the Executive Council. By the time we got to 1939, the League was all but destroyed, and part of it was this. Early on, as the Charter of the UN was being negotiated, it was very consciously omitted from the Charter. Majority voting was the way to go. Article 18 of the Charter, every member state has a right to vote. There is nothing in the Charter about consensus, nothing. If you had to imagine every government, or let's say every National Assembly, the US Congress, the British Parliament, had to adopt every decision by consensus. Already it's bad enough, right, in most governments. By consensus. I mean, it's ridiculous. So why is it the case that you hear time and again in negotiations in Geneva, nothing is agreed till everything is agreed? Why is that the same principle in climate change? Nothing is agreed till everything is agreed. It's a recipe for weakness and failure, but it's very deliberate. You know, when Juan Pablo was talking, it reminds me, I think Mary would agree, when we used to visit many countries as High Commissioners for Human Rights. What you notice is the denial of access to health in many countries is deliberate. It's not an accident of development. It's deliberate. Why? Because discrimination hasn't been dismantled yet. Right? There must be a confrontation all along these axes, all of them, right? And a reality spoken. And we know we can't just parrot the same thing, make the same mistakes. I think this is what Helen's saying. I mean, the reason why health is weak, it's obvious why it's weak. It's obvious why climate change, the agenda is so weak. Right? The industries are powerful, too powerful. And it's not for their own good, of course, that it's like this, because ultimately we will suffer. But I think listening to the points made by everyone here is that there's an earnestness to reach a result. We still have to have the bloodbath over financing. That's yet to come. The zero draft was a disappointment to many of us. It's clear. The compilation draft, of course, has everything in it, so we're happy with that. And the bureau draft, no one knows what's happening with why it exists. So we're going to see now in INB 7 what happens, and I think your vigilance will be critically important. Thank you.
You see why we assembled these folks, because this is the time where we need to speak directly about what needs to be done. And we need all of you in this room to help carry that message forward. So I want to turn to the audience, and I know our speakers also have more they want to say. So with the time remaining, we'll try to get in as many points as possible. I first want to invite Chikwe Kwezu, who's the Assistant Director General for Surveillance at WHO, who's joined us. Just Chikwe, offer a thought or a question to what you've heard today. And obviously you've been at the center of one of the challenges in the middle of that also is one of the actions we need to push forward on, which is strengthening a global surveillance system. But thoughts from you, Chikwe. Test.
Thanks, Caroline. When the elders are disappointed, it's very difficult to follow follow that act. But and I agree, there's a lot to be disappointed about, but there really is a lot to be also grateful for. The changes that we have seen at the country level in the infrastructure needed for health emergency preparedness and response, in the lab systems, in surveillance, in the spread of EOCs, in the growth of sequencing labs, countries have capacity that they've never had before and are driving the interest in the pandemic fund, the number of applications that deserved funding, the growth in the workforce. There's been an incredible, phenomenal growth around the world. And what our responsibility collectively is to support that. And the way we look at this in WHO, there's the governance discussions, which are very important, happening today and in Geneva. There's the financing discussions, which are very important as well. But governance and financing are necessary, but they're not sufficient. Ultimately, it's the people, the systems. And the biggest change that happened for us after the Ebola outbreak in 2016 was the setup of the WHO's emergencies program. And within that program, at the country, national, and regional level, every single day, this morning, is detecting events, responding to them. The machinery is working quietly in the background. So we have a responsibility to think, how do we enable the colleagues working in these places, supporting national institutions that do the work primarily, to do this better every day. And so I think in the midst of the very important governance financing discussions happening, it's also important to just lend a word to the colleagues doing the grind every single day and the courage it takes to keep improving as that happens. And just to end on that note, the world is like, COVID changed the world in many ways negatively, but in terms of the infrastructure in countries and the prioritization of surveillance, all the things that we do every day, I mean, it's like night and day on the positive side from where we were 5 years ago.
Thank you, Chikwe, and thank you for all the work that you and your team at the Surveillance Hub in Berlin, but also overall at WHO. I know we're joined by several of our WHO colleagues today who, like you said, are working day and night to keep us all safe. And goes back to why we're here, right? We're here to do the things that we know what we need to do. And the machinery is in place. We need to support that machinery. We need to get the leadership in place. We need to get the money in place. We need the systems and we need the accountability to make sure that we are continually revisiting this. Winnie talked about a plan, but not just a plan, revisiting constantly that plan, that constant vigilance and surveillance. And that's where high-level leadership and accountability mechanisms come in. I also wanted to just quickly invite Priya Basu. Priya is the executive head of the Pandemic Fund. Priya, we've talked a little bit about the Pandemic Fund here, but anything you wanted to add just about the challenge you're facing in terms of the year ahead to get the Pandemic Fund to move up to the next level?
Thank you, Carolyn. And it's great to see the strong calls to action for the focus on pandemic prevention, preparedness, and response, because while we in this room are collectively agreed on the importance of focusing on this agenda, as many have pointed out, in the face of multiple crises, it's really hard to keep that attention. And there is a pandemic amnesia in many places. So, from the perspective of the Pandemic Fund, we continue to persevere. work hard to kind of raise attention to this agenda, keep that momentum going. We're very grateful to everyone who's contributed very generously. $2 billion. It is not enough, but it's not a small amount either. And for every dollar of financing that we've allocated in our first round of funding, we've actually catalyzed $6. So, our 2 billion is going to go a lot further. Having said that, we're looking forward to mobilizing more and to be able to do more. And the demand that we have from our first round of funding really does show that maybe in Geneva and New York, there might be amnesia, but there isn't amnesia in the countries that we want to help, because the countries that we want to help, low and middle income countries, are really calling out loud for more financing and more support to strengthen their pandemic prevention and preparedness. So thank you again.
Thanks, Priya. Let me see how many interventions. We'll take a few from the audience, as many as we can before we have time. Let me go here to the right to Nina Schwalbe.
Hi, thanks very much. I'm Nina Schwalbe from Spark Street Advisors. And as we limp to tomorrow, I take in the words of the tennis player Venus Williams, which is when you double fault and double fault and double fault, you just have to think about the next serve. So in taking Mary's optimism, I want people to imagine a utopian world where it's May 2024 and the World Health Assembly has just adopted the coolest ever pandemic treaty with everything we want.
I don't think anyone's ever used the adjective coolest, but I like that.
Coolest ever pandemic treaty with everything we want. Then what? And my question really is, how do we hold states accountable for the commitments that they've made? And this comes back to this idea of independence and independent monitoring and what is independence. And I guess, Zaid and Mary in particular, because I think there's so much to learn from the human rights experience on this and the atomic energy, but how do we put in place even a simple system that can say, are states reporting on their obligations? Are they completing the form? Are they doing it in a timely fashion? And is that reporting accurate? So I'm really, that's what I'd like to think about a little bit. So imagining success, and then what does success look like, and how do we hold states accountable? Thank you.
Independent monitoring and accountability. Okay, let me turn over here. We have Justin, I think. Is that who I see in the back?
Thanks very much, Carolyn, and congratulations to all panelists for two excellent panels. Justin Kuhnen, co-chair of UHC 2030, the International Partnership for Universal Health Coverage. We are, of course, here for the high-level meeting on PPPR tomorrow, but I want to pick up on some comments Juan Pablo made, that we're also here for the high-level meeting on UHC the following day and the high-level meeting on TB the day after. And on the one hand, it's a terrific thing that we have 3 days of high-level meetings at UNGA. It's the first time this has happened. On the other hand, there's a potential for fragmentation. Where do heads of government place their attention? And does this relate to the point President Robinson made about the role of health and the priority of health in a broader agenda? So I'm interested in the panel's comments on how PPPR fits into the health agenda as a whole and how we integrate across health issues. Thanks.
Thanks, Justin. The woman in yellow here.
Thank you, Sally Davis. I'm here as the UK government's
special
envoy on AMR.
Forgive me the lights.
So
thank you for joining us.
Thank you. Great panels, great discussion. I just want to highlight two things. The first is, of course, we're in the middle of a grand pandemic of superbugs of AMR. Thank you, Pablo, for mentioning that. There will be a high-level meeting next year. So that challenges exactly what the previous speaker said. How do we bring all of this together to make progress and strengthen local health systems and communities? And to say that I am proud, following on Chikwi's intervention, of our Fleming Fund. Our ministers have just announced another more than 200 million to support laboratory development in low and middle income countries. And I think that alongside the pandemic fund, these investments really can make a difference. Thank you.
Thank you, Sally, very much. I think we can just take two more because we're a bit short of time and I want to come back to my panel. I'm getting a lot of lobbying from the middle there. Okay, please.
Where did you point?
Right in the middle, there's a,
Yes.
I think, speaking on behalf of a group, so please go ahead. And apologies if I can't get to everyone.
Hi, my name is Kira. I'm an infectious disease epidemiologist from the London School of Hygiene and Tropical Medicine.
Welcome.
Just really want to quickly say, express my admiration for President Robinson. I don't think I was born by the time that you were elected, but
You're making us all feel.
that says more about me, I think. But growing up in a society with a female president, I think, made me feel like I could do anything. But to my question. Just to my question really quickly, I noticed that we're talking about all of this in the context of the term pandemic. And I was wondering if we're trying to promote an always-on approach, are we missing a trick in acknowledging the fact that a lot of the steps that we can take for pandemic preparedness have real-time like positive health outcomes? I think like the example during COVID is that respiratory illnesses like flu, like in the UK, we had the lowest level flu season in years. And a lot of the data gathered during COVID, like contact matrices and stuff, are being used now to shed light on population dynamics of a host of different viruses. So I was wondering, basically, how do we tread the line between using the term pandemic because it's important and it's attention grabbing, and also making the point that, you know, it doesn't just have to be a pandemic for a response to be really important. There's a lot of diseases out there that are not necessarily undergoing exponential growth, but have a really, really high burden. So thank you.
Super important in terms of always on. And apologies, I'm only going to be able to take one more question. So this gentleman here, that's it's Neil. Sorry, it's very hard to see with these lights.
Thank you. Amazing panel. Really appreciate all these insightful comments. And my question is about how do we get nature more into this conversation? There's a lot of discussion about tying together issues. Pandemics and climate change are intertwined crises that feed off of each other, and they're both rooted in our broken relationship with nature. And I see nature overlooked in both of these sectors, and so it'd be great to get your thoughts on how we can talk more about nature and all of this.
Thanks, Neil. We're running out of time. We also have a question from online. Have the right lessons been learned from COVID-19, and what would have been necessary for a profound evaluation of Act A? So I'm looking at you, Helen. I'm going to go down the line, starting with Winnie, ending with you, Helen, for reacting to some of the questions that you heard we had specifically on independent monitoring and evaluation, connecting the dots across UHC and PPR, the important point from Sally on AMR, and to your earlier point, Winnie, which I would have asked you if we'd had more time, but you know, how do we not make this PPR versus pandemics versus UHC versus AMR versus HIV and AIDS? How is it both and? Because we have to address all of these things that are all connected, but they all have particular solutions as well. Pandemics needing to have systems that are always on, and the stronger connection with climate. So take those as you see fit, but over to you, Winnie, and we'll go down the line.
I'll just go back to the bottom line, the money, on the money issue. You know, I was asking Juan Pablo here that how much money is in that pandemics fund, and he said he didn't know, but you said 2 billion. Okay, 2 billion. Now, the context is this, that Africa in 2021, in the middle of this crisis, Africa paid $79 billion in debt servicing, paying rich countries who were the creditors and their companies and their financial institutions. 79 billion was being paid back in a time of crisis when people were dying. Now you set up a fund and you put there 2 billion. That's not a solution. We need an emergency financing mechanism in that treaty, so that is triggered when there's a crisis, and that countries can get the fiscal space quickly and respond and save lives. It should be there. Thank you.
Thank you, Winnie. Juan Pablo.
Thanks. By the way, I did know how much money was in the pandemic fund. Otherwise, Priya would be very angry with me. Huge disappointment, Winnie. No,
friendly multilateral competition here.
yes, we'll follow on it, by the way. But no, quickly, I have two closing comments, Caroline, and again, huge thanks. One has to do with, I do not belong to this global public health arena, and I came in only 2 years ago, but I've been impressed with how much we fragmented and how much we compete inside of it with multiple, all well-intended initiatives, all important initiatives, but they all take place within the same health system. Sorry, the same budget, the same institutional capacity, the same leadership, at least at the country level. Globally, there's institutions that represent all of that. When you go to my Ministry of Health, it's only one ministry. It's only one health system. It's the same subnational levels and everything comes together. And we cannot keep on competing within weak health systems, trying to say that A is more important than B and it's more important than C. It's terrible. It's terrible not to be talking here about women's and adolescents' health. It's terrible to be ignoring so many other things which are wrong out there. So I do believe we need to maintain the accent in pandemics, but we need to do it, Caroline, within a health system strengthening message. It should bring us together. President Santos said, if you're able to embrace bigger causes, you have more visibility, you have more leverage. I feel that many times we're breaking them down. So I would say that's a major topic I would insist on, and it's the health system strengthening. I'll let it there.
Thank you, Juan Pablo. And Paul, you're looking at this now, setting up a new office at the White House, taking this all in. What do you take away from this conversation?
I think Juan Pablo got it right. This has got to be a conversation in the context of the broader conversation. It can't be a standalone. I mean, we recognize that there were many things we could have done better in our pandemic response, both domestically and globally. That's the nature of anything this complex and difficult. And that's why we've created this office. And we hope other countries will see the value in doing that as well, to have that integrating function. Chikwe, I think you got it exactly right. There has to be a commitment for collaboration. If it's only about criticism, it's difficult to move forward. There has to be a commitment for collaboration. And what we're seeing is some real progress in a number of areas. The ability to build out the surveillance network to detect outbreaks early is a tremendous accomplishment, and one that we must continue investing in through the Fleming Fund, through the Pandemic Fund, through all of the other mechanisms that are out there. But it cannot be that this is the sole issue. It's one in which we integrate efforts in the context of, as was pointed out, the One Health approach, recognizing that many pandemics don't originate in humans, they come from other species. It has to be based on that foundation of One Health, and then worked on as a partnership, not a competition.
Thank you.
Coming.
Magda, you're the right one to speak to that.
I was going to touch on that one, but before I said that, I would like to also insist on the issue of financing and then say that within low and middle income countries, we have shortage of healthcare workers, but we have a massive unemployment of trained healthcare workers. So if we don't fix the financing issue, we'll continue navigating in a sea of plenty, but being hungry, not having enough healthcare workers. And don't forget, majority of healthcare workers are women. And unless we look into the demographics, we make sure that women lead where they know best, because they have experience, knowledge, and all the capacity to lead health systems. We will continue talking about this forever and ever. Don't forget that the world is made up of majority of young people, particularly in low and middle income countries. If we don't cater for the young people, if we don't bring them on board, make them take the decisions that matter for them, we will miss the boat. And then finally, I would like to say that if you knowingly leave people behind, you are actually knowingly pushing people behind. So we really need to be building pro-equity systems where people are not being pushed behind. Thank you.
Thank you, Magda. Joy, monitoring, accountability. How do we make things different next time?
Thank you so much. And I agree with what my fellow panelists have just said. But I think one important message that I would like to leave with all of us is that the world still lacks the necessary knowledge and monitoring capacities for pandemic prevention, preparedness, and response. In all areas, whether it is the One Health, whether it is linkages to climate change, whether it is even surveillance and genomic surveillance in particular, we are still way behind. And we still lack the capacities for independent monitoring. So we are dominated currently now by mistrust. And my proposal is that we must rebuild this trust with measures that are necessary to improve the accountability and transparency that is required in order to prepare us for the next pandemic. Through community engagement, engaging women, but also through strengthening of multilateralism. We consistently talk about multilateralism, but we are not walking that talk. Let's walk the talk and accept that we must be held accountable for what needs to be done, and that we must monitor ourselves in order to ensure that we deliver on our debt to society. Because this is what it is. We need to protect the planet and its people, and we are not doing it at the moment. Thank you.
Thank you, Joy. Zaid.
So very quickly, I just want to recall Mannheim's paradox, that you can't discover water if you're a fish. You can't solve these problems if you're only public health officials. There are other mechanisms. The question was raised, why is health so weak? Why is human rights so strong by comparison? Why is there no UPR for health? Or why hasn't there been a UPR for health? Why don't you have special procedures for health and special rapporteurs going into countries and digging deep and producing their reports for discussion? I mean, it's amazing, this. So I think, Nina, your point is very well taken. There needs to be a global health council. There needs to be the sort of mechanisms like we have in OPCAT, the optional protocol for the Convention Against Torture, intrusive inspection regimes. It was dropped from the text early on like magic. It just disappeared with no real explanation, right? So all of that needs to change. I mean, it's very clear. Very quickly, integration of the summits and the different meetings. Well, you know, Helen Clark and I at different times ran for the Secretary Generalship of the UN. And I'm just saying, if you want to know how to, I'm just kidding, of course. She got more votes than I did. And so, no, I mean, it's a matter of how the UN prioritizes all these meetings. I mean, we have now perhaps too many meetings, and we have a sort of delegations are running around like you know, a headless chicken.
You just want to get it done.
Yeah, it's like forced ADHD. You can barely manage. Now, finally, Neil's point. You know, the broken relationship we have with nature. It's very true. We'll see what happens out of COP15. We have now a new set of targets on biodiversity. We'll see what happens. But P.C. Cheng, the philosopher and diplomat who contributed to the Universal Declaration of Human Rights, when asked what is the point behind the declaration, and of course it came at the end of a horrific war that occupied many parts of the world. And he basically said, the declaration is there to make us better human beings. If at the end of this pandemic, horrific pandemic, we haven't become better human beings, then of course, I mean, it's not just shameful, it's beyond that. We're beyond recovery. So we have to learn and do things differently.
Well said. And Helen, thank you, Zaid. Helen.
I don't think we should see the pandemic high-level meeting as one of 3 health meetings. It isn't. It isn't. A pandemic is a complex emergency. It needs multi-sectoral approaches, and that's why really bringing this leader-level lens to it, whole-of-government lens, knowing that the whole orchestra has to play for effective preparedness and response is so important. And I think there's a message in that for the health sector in general, that so much of what health wants to achieve is actually beyond what any health minister, sector, institution can actually do. You know, social determinants are far, far broader. And I think a message to health is to behave much more collaboratively around these kinds of issues. Secondly, on in violent agreement with Prince Saeed on the issue of the institutional mechanisms of the Human Rights Council and what we could use for that. Why not more, special rapporteurs out of the system on these kinds of issues? Why not universal periodic reviews? They've actually been quite effective in calling stuff out in the human rights system. A comment on the point made about what we learned from the pandemic about how to suppress infectious disease in general of the respiratory kind. Yes, flu went down. Other viruses went down when we were masking and observing measures. But then when we threw the masks away, they all came back with a vengeance. We've had the most terrible season of viruses in New Zealand over the last couple of winters as measures relaxed. So learning some basic public health measures about not going to work when you're ill, wearing masks to protect yourself and others. But then that's not standalone either. You need decent social protection to back that. You need to know that if you don't go to work, there's sick pay, right? If you can't go to the market to trade, that there's something behind you. So again, trying to keep basic public health effective has social determinants which need to be addressed. And lastly, on the issue of nature, the way we've trashed our forests, the way we've intruded on the natural ecosystems, the way we've let wildlife trafficking continue, all of this contributes to the spread of zoonotic diseases, which is increasing in volume and runs the risk of putting us where we were with HIV and Ebola and COVID and other diseases as well. Thank you.
Thank you, Helen. So many pearls of wisdom, so many concrete, direct recommendations of what we need to do. We know what we need to do. We just need to do it. Please join me in thanking our terrific panel. And just to close this out, let me call on my Eloise to send us home.
Thank you so much. What a brilliant event. Thank you to everybody for being here, for choosing to be here in your busy UNGA week. Just to say, with the power of the audience here online, the power of these speakers and our panels, there is a lot that we can do together. One practical thing, if you haven't yet signed up to the Pandemic Action Network Agenda for Action, please do come to talk to us and we'll tell you more. And if we are keeping to double faulting, we have to focus on the next serve. So it's about the next year. Give yourselves a massive round of applause. Join us for a coffee at the back. Thank you to our teams for putting this together. Thank you to our speakers. Thank you to Carolyn for moderating, and have a wonderful week.